In this session, we are going to talk about careers in imaging services. My name is Maribel Tharp. I am the Assistant Director of Radiology here at DHR Health. So my path to becoming a radiologic technologist started many, many years ago. I did go to South Texas College, and it is a 2-year program. There are several prerequisites and co-requisites that come with the program. So those prerequisites you need to take beforehand in order for you to apply into the program. But if you have some extra time before the application deadline, then you can also take some of those co-requisites ahead of time and clear those out before. The program coursework itself is 2 years. So with those two combined, the program and the prerequisites, you're looking at about 3 years overall. With the tuition, as far as the overall amount and the quality, you would have to check with STC to see what the tuition costs are. However, there's so many opportunities to pay for your tuition, including financial aid, scholarships, and workforce solutions. In my experience, I didn't come from a home who was able to pay for tuition, so I came from a low-income family, and I qualified for financial aid. And during that, once I got accepted into the program, I heard about a lot of different programs, and I did a lot of homework. I Googled everywhere to be able to find the opportunities that were available to me as a student. And I came across Workforce Solutions. I went over there. I talked to someone, an advisor. They directed me in so many directions to apply for different things, and I qualified, and I was able to get that. So through Workforce Solutions, they paid for my tuition, they paid for some of my textbooks, a backpack, and even some school supplies at that time. So, it doesn't hurt to check in there, call Workforce Solutions, see what type of opportunities they have. And then during the program itself, I did get a lot of scholarships. I continued to apply for scholarships just for that extra support to make those ends meet and be able to pay for everything that I needed to. So a day in my shoes. Right now, I am an assistant director of radiology, but when I first graduated, that wasn't the case. I came on board as a radiologic technologist. I started working at a local hospital before coming into DHR Health as a surgery tech. I learned how to run the C-arm in surgery, helping surgeons locate areas so that they can conduct their surgical procedure. As a rad tech, you come in, you assess and verify the physician's orders for the exams, make sure the diagnosis correlates to the exam. For females of childbearing age, you want to make sure that there's no possibility of pregnancy. And if there's a contrast medium like iodine that they inject into the bloodstream, you want to make sure that the kidney functions safe. So there's a lot of things that you need to assess and consents that need to be filled out in order to make sure that the right procedure is being done for the patient. As a rad tech, you interact with multiple roles and departments, including physicians, the radiologists plus ordering physicians, the nurses from the nursing floor, from the emergency room, phlebotomists, respiratory techs, directors and administrators. They come around, checking for compliance, with the type of procedures, the cleanliness of the rooms, and some safety team members to make sure everything's working right with the fire safety, the fire extinguishers, and EVS personnel as well that come in between. Rad techs respond to code blues for X-ray, trauma codes for X-rays and CTs, and code strokes for CT. They also assist with CPR when it's needed, especially when it happens in your own department in radiology. As an assistant director of radiology now, I oversee staffing, productivity, employee development, handle a lot of employee compliance issues, make sure that they have their credentials up to date, interviewing and onboarding of new staff, take care of a lot of payroll, time cards and time off requests, approving for vacation time and holidays. I also handle development of presentations such as this and forms, policy forms or assessment forms for our patients. I handle employee issues and some disciplinary actions, and also take in and handle any physician or patient concerns that they have, good and bad. Some fun facts. So some fun facts for radiology. X-ray was actually developed by accident. William Conrad Röntgen discovered X-ray in November of 1895 when he accidentally X-rayed his wife's hand. So you'll see a lot of X-ray images if you Google it of a hand with a wedding ring or an engagement ring. And that was his wife's hand that he accidentally X-rayed. So from there, a lot of development has occurred. And now we have so many service lines in radiology. In 1927, 37% of radiologic technologists were nuns. Today, there are over 330,000 registered radiologic technologists. And one last fun fact in observance of Breast Cancer Awareness Month, the first ever 3D mammography exam was performed in the US in 2011. And here you'll see some images of some of our imaging specialties. So on the left side, you see a regular, normal chest X-ray. And on the right side, you see an upper GI exam being performed under fluoroscopy. So you see the white part is the contrast that's going through the stomach, and the black that you see inside the stomach is the air in there. So you see how it's starting to go into the small bowel system. And here on this next slide, on the left side, you have a CT of the brain. So you are able to see that. What CT stands for is computed tomography. So it takes like slices, almost like a bread loaf, where it's cut into slices. So when it's scanning thousands of images into little slices like that. So there's a couple of slices that you can see there. So it helps the radiologist to visualize any hematomas, any blood in the brain, like for stroke patients. And on the right side, you see an example of an MRI of the lumbar spine. Down there towards the bottom, you see a black circle through the spinal cord, and that's a herniated disc that's bulging out there. You see some little, almost like fibers sticking down. Those are some of the nerves that are just being pinched there and are trying to get past the herniated disc. And just some helpful tips. If you are interested in radiology, there's just a few things that any medical professional needs. You have to have a huge interest in the medical field. And sometimes radiology is not a field that you think about when you think about the medical field. You think about nursing, you think about being a doctor. Those are two of the major things, but there's so many careers in the medical field. So do your research on that and look at different opportunities. In radiology, it's good to love to understand how things work, because there's a lot of physics, and don't get scared by physics, trust me. I know I was, but you'll learn how to understand how X-ray is created and why the images come out the way they do, and what you can do to make it better and fix the images. And passion. You have to have a strong passion to help care for people. You know, they don't want to be in the hospital. They don't want to go to the doctor's offices. I know I don't when I do. I don't want to be here. So you need to have that extra compassion and love for people in order to be able to do what you do here as a medical professional. So that is some of my tidbits and information, some of my pathway to becoming a radiologic technologist. I hope that it inspired some of you to look into this field a little bit further. And if you feel that this might be a career for you, feel free to contact me if you want more information, get more details. I know this is a short presentation, and I have 17 years, in radiology. So feel free to send me an email. There, my contact information is on the slide. m.tharp@dhr-rgv.com. Thank you all for your time, and I wish you the best in your future. Just remember that every choice you make now at this moment directs your path to where you go. So choose them wisely and take care. Best of luck.